Soft tissue injury management. Introduction. Any injury to ligament, tendon, synovium, capsule, articular cartilage, and fascia is known as soft tissue injury. Sprains, strains, and contusions, as well as tendinitis and bursitis, are common soft tissue injuries. They occur due to trauma or overuse of muscle, tendons, or ligaments. They are a result of a sudden, unexpected, or uncontrolled movement. Soft tissue damage can also occur from excessive overuse or chronically fatigued structures, especially muscles and tendons. The soft tissue injuries fall into two categories: acute injuries, overuse injuries. What are the most common soft tissue injuries? Ankle sprain, back strain, calf strain, golfers or tennis elbow, hamstring strain. What is the difference between a strain and a sprain? Tendons are fibrous band that attaches muscles to bone. Trauma to muscles or tendons due to overstretching is referred to as a strain. Ligaments are fibrous bands that hold bones together. Trauma by overstretching of ligaments is referred to as a sprain. Sprains and strains are both very common and can occur from accidents during sport, at home, or at work. There are three levels or grades of severity. Grade 1: mild strain or sprain, minimal overstretching, possible minor microscopic tearing of fibers, mild tenderness, and minimal swelling. Grade 2: moderate strain or sprain, partial tear of fibers resulting in abnormal laxity, moderate pain, tenderness, and swelling, unable to apply loading to the injured area without pain. Grade 3. Severe strain or sprain. Complete rupture of structure, significant pain and swelling, inability to use the injured structure, instability of the affected joint. Sign and symptoms. When soft tissue is damaged, there is usually immediate pain along with immediate or delayed swelling. Excessive swelling can slow down the healing process. Muscle weakness, spasms, and cramping may also occur. Stiffness is also very common as a result of the trauma and swelling. Bruising may also develop after 24 to 48 hours. Echymosis. In the case of moderate to severe soft tissue injuries of muscles, tendons, and ligaments around a joint, there may be instability experienced, especially to weight bearing joints like the hip, knee, and ankle. With severe trauma, there may also be a fracture. There is an unusual deformity or shape. You might have heard a pop or crack at the time of injury. Surrounding bony structures are painful. There is the presence of neurological signs like numbness or pins and needles. Soft tissue management. The management of soft tissue injury has 8 aims: to reduce local tissue temperature, to reduce pain, to limit and reduce inflammatory exudates, to reduce metabolic demands of the tissue, to promote the damaged tissue from further injury, to protect the newly formed fibrin bonds from disruption, to promote collagen fiber growth and realignment, to maintain general levels of cardiorespiratory and musculoskeletal fitness and activity. Biomechanical implications, inflammatory stage, price, protect, duration, mode, immobilization, rest or relative rest, avoid stress, reduced general activity. Ice, duration, frequency, method. Compression, elevation, lowers local blood pressure, limit the bleeding, increase drainage of inflammatory exudates, reduce edema. Early mobilization needs to occur, but very carefully to avoid triggering further tissue damage. Management guidelines, acute stage or protection phase. Educate the patient, recovery time, protection, precaution, control pain, edema, spasm, cold, compression, elevation, massage. Immobilize the part, rest, splint, tape, cast. Maintain soft tissue and joint integrity and mobility. Appropriate dosage of passive movements within limit of pain specific to structure involved. Appropriate dosage of intermittent muscle setting or electrical stimulation. Reduce joint swelling. May require medical intervention if swelling is rapid. Provide protection, splint, cast. Maintain integrity and function of associated areas. Active assistive, free, and or modified aerobic exercises, adaptive or assistive devices. Signs of too much movement are increased pain or increased inflammation. Contraindications, stretching, and resistance exercises should not be performed at the site of the inflamed tissue. Exercise progression may cause muscle soreness that can last up to 4 hours. So keep in mind these signs. If muscle soreness not resolved after 24 hours, progressive increased feeling of stiffness and decreased range of motion, swelling, redness, and warmth in healing tissues, progressive weakness, decrease functional usage. Biomechanical implications, proliferation stage. Focus on gentle range of motion, but not so vigorously as to disrupt the scar. Overly vigorous mechanical loading during the repair stage of healing CT. Restart the inflammatory stage. Excessive scarring or weaker repaired tissue. Management guidelines, sub-acute stage. Educate the patient. Teach home exercises. Monitor and modify as patient progresses. Promote healing of injured tissues. Monitor response of tissue to exercise progression. protect healing tissue, increase amount of time the joint is free to move each day, decrease use of assistive device, restore mobility, progress from passive to active assistive to active range of motion, gradually increase mobility of scar specific to structure involved, progressively increase mobility of related structures, develop neuromuscular control, muscle endurance, and strength. Multiple angle isometric exercises. Begin cautiously with mild resistance. Initiate active range of motion and weight bearing and stabilization exercises. Progress resistance later in this stage. Maintain integrity and function of associated areas. Apply progressive strengthening and stabilizing exercises. Resume low intensity functional activities. Precautions. Eccentric and heavy resistance exercises should not used in the early subacute stage. Biomechanical implications. Remodeling. Regular stress sufficient to provide tension without damage. Collagen undergoes chemical and structural changes that allow elongation and strengthening of the affected tissue. Remodeling does not progress to the point of recreating a normal ligament tendon. Management guidelines, chronic stage or return to function phase. Continue progressive strengthening exercises and advanced training activities. Progress aerobic exercises using safe activities. Progress exercises. Stretching techniques specific to tight tissue. Safe progressions of exercises and stretching. Educate the patient, increase mobility, improve neuromuscular control, strength, muscle endurance, improve cardiovascular endurance, progress functional activities. Precautions. There should be no signs of inflammation. Overuse, cumulative trauma, repetitive strain, imbalance between the length and strength of the muscles, rapid or excessive repeated eccentric demand, muscle weakness, bone malalignment, change in the usual intensity or demands, returning to an activity too soon after an injury, sustained awkward postures, Cumulative trauma, chronic recurring pain. Guidelines, interventions during chronic inflammation. Educate the patient, promote healing, decrease pain and inflammation, maintain integrity and mobility of involved tissue, develop support in related regions, controlled motion and return to function phase. Educate the patient, develop strong mobile scar, develop a balance in length and strength of the muscles, progress functional independence. Thank you.